With me is the Republican governor of New Jersey, former top Trump advisor, Chris Christie, also a current Trump friend. I think that's fair to say.
Absolutely.
And you're an unofficial advisor. You guys talk all the time.
We do.
What grade would you give him?
Listen, I'd give him a B so far.
A B?
I would. I'd give him a B. And I would say the reason I give him a B is first and foremost because of Neil Gorsuch. And I think getting that done and getting it done in the way that he did with someone with Gorsuch's integrity and his record is going to be something that will well survive his presidency, no matter how many years he serves. I think that's a really important accomplishment for the American people moving forward in terms of supporting his agenda. I also think some of the things he's done by executive action have been very good on the regulatory side. And I can see even in New Jersey that businesses are responding really well. And I think, but some of the implementation and some of the ways that his staff has served him has not been extraordinarily good. And I think, they've got to get their act together in that regard and serve the president better.
Well, specifically, I assume you're talking about the travel ban. Are there other items that you?
Sure. Well, I don't think that the way the whole health care situation was handled, either on the Hill or at the White House, was exemplary. We didn't get the result that we needed to get. Now, I know they're going back at it again, and I wish them the best of luck at it to try to get something that'll be able to pass the House and Senate and get to the president's desk. But, I've been a governor for 7.5 years, and you rely upon your staff to be able to tee the ball up and make sure that when you swing, you hit the ball, and you hit the ball far. I know they're working hard at it. He's got a lot of very good people there who are working very hard. But, the American people and the 100-day mark is one of those things, no matter whether you think it's real or artificial. It is a historical marker for a long time. And people will start to judge you. They judge governors and presidents by how many touchdowns you put in the end zone.
Right.
You got to put touchdowns in the end zone, and the president knows how to do that. He's got to make sure that we get everybody focused on the task at hand.
Is there anybody in the White House that has ever run a government before that you know of?
Run a government? I don't think so.
I mean, in the way that you run the New Jersey government.
No, there's certainly no governors that are in the White House.
Or how about with experience in government before?
Well, listen, I think there's some guys like Rick Dearborn, for instance, who's his deputy chief for legislative affairs. Rick has a long history on Capitol Hill, last with Senator Sessions. I think Rick is a very competent guy in terms of knowledge of government. So that's one person that I know for sure, and I worked with Rick during the transition.
Fair that there aren't enough, though? Is it fair to say there aren't enough people?
Well, I think listen, time will tell. I mean, everybody's taking a different approach. They're taking a different approach. We're going to see if that approach is effective or not in the long run. So far, I think not having a number of people there at the upper level who know how to do those things is creating a delay. Now, let's see if it bars them from doing things. Right now, it's just creating a delay. But the thing that keeps moving this administration forward is the president and the president's, charisma, the president's push. For what he wants to get done. He believes in certain things, and he continues to talk about those things. And I think that's the main driver of this administration is the president, but the president needs to make sure that he's got people pushing behind him.
I've heard people say that one of the biggest mistakes that the Trump team made was during transition when Jared Kushner and Mike Pence took over the transition from you and threw out your plans and started from scratch. And obviously the transition was a rocky period. Is that a fair criticism?
Well, I don't know, because I wasn't involved intimately in what they did after I left.
Right.
And so it's hard for me to gauge that, Jake. I can tell you that during the time that we led the transition, we put together a really deep, detailed, effective plan in the likelihood that Donald Trump was going to become President Trump.
Right.
So I'm proud of the work that we did. And I think they decided to go in a different direction. That was clearly their choice to be able to make. I have great respect for the vice president. We work together as governors. There's somebody in the White House, by the way, who has run a government
Vice
in
President
Indiana.
Pence, sure.
Vice President Pence did a great job in Indiana. And I have great respect for him. And that's why when the president asked him to take over the transition during the post-election phase, I didn't have a problem with it because of who he asked to replace me,
right,
which was the vice president who had a lot of experience.
So you were appointed to chair a White House commission on the opioid epidemic, which I know is an issue you've been very active in New Jersey. The president tweeted about the border wall today. He wrote, "The wall is a very important tool in stopping drugs from pouring into our country and poisoning our youth and many others. If the wall is not built, which it will be, the drug situation will never be fixed the way it should be." You're an expert on the opioid epidemic or in government trying to push solutions. How much of it is drug dealers from Mexico or from wherever, and how much of it is big pharma pushing opioids in a way that's irresponsible?
Well, I think it's a bit of both,
yeah.
Jake. I think, there's no doubt that the cheap, pure heroin that is coming up from over our southern border is replacing opioids. The dynamic is this, for people who've really studied it, and we have in New Jersey. 4 out of every 5 heroin addicts start on prescription opioids. 4 out of 5.
Right. They get a prescription from the doctor. They hurt themselves. They have some sort of pain.
And they get addicted almost immediately. The people who have an addictive personality or an addictive disorder, they get addicted almost immediately. But then they can't get the opioids or they're too expensive. And the problem that the president's talking about is the cheap, pure heroin that is coming up that is so much cheaper than the opioids, Jake, that people immediately then become heroin addicts with all of the criminal aspects that attach to that, with the infectious aspects that come to that, and the death. I mean, in New Jersey last year, 4 times the number of people who were murdered by a gun died of opioid overdose.
No, it's insane.
3 times the number of people who died in an automobile accident died of an opiate. 3 times the number of people who died in an automobile accident were killed by an overdose of opioids. So it's a combination of the two. And I think what we need to do, and that's why in New Jersey, we now have a law that says when you go first to a doctor and you get opioids, no more than a 5-day supply on your first prescription. They were giving 30-day supplies of this stuff, and it gets people hooked. And it's one of the things we have to deal with. We need to deal with interdiction at the border. We need to deal with much better education of our kids. We're back in the 70s in education in terms of the mode. They make pamphlets at the Department of Education.
Yeah.
We have young children.
Right.
They don't read pamphlets.
No, pamphlets is
if
not
it's
the way to
not
do it.
on their smartphone, if it's not part of social media, they don't get it. I'm going to reach out to our folks and our friends in social media to say, how can you help in educating kids about the dangers of opioids, the dangers of drugs? And the third piece is treatment. We need to make treatment less stigmatized and more broadly available.
And the step-down program so people can get off the prescription painkillers instead of going into
and
heroin.
sometimes it's medication-assisted treatment as well, Jake. That's really important.
You'll come back and talk more about the opioid epidemic, I hope, because we want to cover it a lot more this year.
We will.
Thank you so much. It's good to see you, sir, as always.